The mission of the Free Clinic is really twofold. First, we seek to provide health care to people who don't have access to health care otherwise. And second, we seek to advocate for extending health care coverage in our country to everybody, including those who right now do not have access to health care.
I've been involved with the Free Clinic since its inception. I'm a lawyer, and the firm Thompson Hine, with which I'm associated, represents the Cleveland Foundation. And the Cleveland Foundation decided in roughly early 1970 to support a group of physicians and other healthcare workers that were working from their homes, helping adolescents at the time who were estranged from traditional healthcare and needed medical services. Principally, those kids were using drugs and didn't feel they could go to their family physicians.
There was an attitude among young people that they weren't going to necessarily just buy whatever authority figures were telling them. And medical people were seen as authority figures. I remember this was a house, and we talked people down from bad drug experiences on their back porch, and the separate rooms of the house were different rooms where we did exams and stuff, and we actually worked very hard to get equipment in that house so that we could see people appropriately.
There were 4 of us originally who were, as you say, the cast of characters. Jean Sonville, Marge Gravatt, Ike Reed, who was a pediatrician, and myself. And really, the idea or the need came out of the scene on Coventry in the 60s at that time, where young people, the counterculture, were doing their own thing, didn't trust the establishment, of which we were part.
I was on the original board of the Free Clinic, dating back to its inception. We were a group that was put together through the efforts of the Cleveland Foundation, with funding also from the Gund and Weatherhead Foundations. And over the years, my brother David Roth was executive director for approximately 10 years. I was a board member for about the same, and my wife continues to be a board member today. My wife has been very active in the fundraising aspect, as was my mother, who is deceased, and our son also worked as a volunteer there.
It was a refreshing place to volunteer because everyone had the same goal and everyone really pitched in, and no one was turned away. Anyone who walked through the door, no matter what their problem was, got some type of service. And it was exhilarating, actually. It was fun, it was exhilarating, it was neat.
The thing I want to say about the clinic is the gratitude that I, as well as other people that I've met there as other patients, feel. The people there are so responsible. They care. And this isn't just a pretend care, they care. If you have blood work done, as I have on more than one occasion, if there's anything at all wrong, you're called immediately and asked to come in again. I don't think you get that if you have good health care from many places. My medications now, after this 7-year stint, has been high blood pressure, high cholesterol, high everything. Very expensive. I don't pay for anything. It's given to me from, I think, a free heart, and I'm grateful for it. The clinic has shown me how to get insurance, so to speak, through Metro. They have a rating program, and led me to the surgery that I had, and I might add, once again, at no cost. I wouldn't have known where to start to get any of these things done. I wouldn't have known I had high blood pressure had it not been for the door being open to me. Not much else I can say other than thank you.
I've been at the Free Clinic now for about 4 years, and probably the biggest thing that I've noticed and changes has been sparked by health reform. You know, we have been over the last 40 years of our existence, a clinic that went from being one where we served people who walked in off the streets with problems as varied as the common cold or really severe mental health issues, to one now where we serve people who come in by appointment and who, again, have a range of needs. But what's really changed over the last few years is trying to figure out what we're going to do in light of what's happened with health reform.
Our three main sources of financial stability are government programs, foundations and corporations, and individuals. And it's really, for all three of those resources, it's really a matter of demonstrating, proving your worth every month and every year when you reach out to them and explain to them what you're doing, what you're planning to do, and asking them to support your mission when there are many other very needed community organizations that you're in effect competing with, and you need to over and over demonstrate to those folks that you continue to play a vital role in the community.
Without them, like I said, I would not be here today. The safety that I feel is great compared to what I would have ever believed I would feel at my age and with my health issues. It's all due to them.